Your doctor gave you a due date and your baby is not showing any signs of thinking that that is important at all. You're 40 weeks or 39 weeks and nothing is happening. What does that mean? What can you do? How do we move forward from this? Today, I have 3 tips on what to do if that sounds familiar. I'm so glad you're here. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, plus 3 babies of my own, which every single one was overdue. And in fact, I went later on every single baby. My last baby was 12 days overdue. Now, I would not recommend that for you. I ended up getting induced and I wish I would have done it earlier. But today I want to talk about 3 things that you can do if you're due and it's just like, nothing's happening. It feels so frustrating.
All nurses to the nurses station.
And I just want to remind you that this is a point where it's really important to decide what is important to you. As I said, I had a baby that was 12 days overdue. And at the time, I felt like one of the most important things was to not get induced. Again, my personal preference. I don't know what your personal preference is, but I think going through a birth plan, thinking about what you'd want, because you may be called to make some decisions as you get to this point in time. Check it out. I have a whole free series for it. I'll link it down below. Tip number 1 is to forget about it. Or if you're Joey from Friends, forget about it. It's so easy to just become consumed with the fact that you thought you were going to have your baby by now, but it is not coming. So I always encourage you to just put that out of your mind, let it go, and move on to some other things. The good news is there is a lot that you could be doing to both prepare for your baby and just be comfortable in those last few days of your pregnancy. I promise you that at some point in time, later in a few months from now, you'll think, oh, I kind of miss it when they were inside and would just kick me a little bit. Now, I'm not saying that all pregnancy is magical. I hate people who do that, but there are parts of this pregnancy that you may miss someday. So savoring those in those last few days can be really smart. Things I recommend: make sure that you're taking your birth class or reviewing it. Go on a walk. Getting a little bit of sunshine and some fresh air can be really helpful. I actually have a whole post on curb walking if you want to give that a try. I'll put the link for that one down below. Cook. This is a great time to make some freezer meals, have some things stocked up for when you come home. Cooking can be a great thing, and I especially recommend having your partner do anything that you are not in the mood to do. Do the parts of cooking that you enjoy and let them take over the rest. And in that same genre, clean. I actually think one of the best things to do in early labor is to get on your hands and knees and like scrub your bathtub or scrub your shower, because that's such a great position to be in early labor and you're productive in getting the things done that you need to do. So cleaning can be a great thing. And again, if there's parts of cleaning that you do not want to do not do them right now. Do the other ones that you want to do. Get those mirrors clean or whatever helps. I love to see clean counters. So if that's you, clean your counters. Watch a favorite movie or do some prenatal yoga to stretch out those very angry ligaments. Your pelvis is doing a lot this far in pregnancy. I actually have a birth class that I recommend that can be done in just 3 hours. It's also not going to break the bank. So it's been taken by thousands and thousands of couples. I'm going to link it down below for you. The last thing that you want to do is just sit there and wallow. Hillary totally did that. I would wallow in the fact that I was overdue and all my friends had their babies before me. It doesn't help anybody. So trying to stay positive, trying to stay active and get things done that might help you out after baby is born can be really helpful. And if you're in the overdue crowd, I'm here to tell you that I really feel like babies who cook a little bit longer, maybe sleep a little bit better outside of the womb, maybe, breastfeed a little bit better. I think there are perks to having a baby who's been in the womb a little bit longer. These are things that I told myself when I was overdue. I think that they are true, but they could also be lies. And if you're looking for something else to do, you can also pack your hospital bag. I actually have a whole hospital bag checklist that I'll link down below for you as well. The next one is to think if an induction is right for you. If you're past 39 weeks, most often, now not at every hospital, but most often your provider may be willing to schedule a 39-week elective induction for you. So it's something that you can review with them. Again, you went through your birth plan at the beginning. Maybe an induction's right for you and maybe it isn't. But I think it's worth having a conversation. And I am here to tell you that I cried and cried and cried about my induction. I have a whole video on it that I'll put down below. But I wish that I had just done it sooner. I don't think my body honestly ever would have gone into labor on its own. I know everybody says your body was built to do this, but I think by number 3, my uterus was like, no, I'm tired. You built the strongest bag of waters that I've ever seen, because as soon as they broke my water, I had a baby really quickly. So who knows? But I think considering an induction can be really helpful. again, it's something that you get to make the choice on. Yes, I do want to be induced. No, I don't want to be induced, which again pivots you towards what you really want for this upcoming birth, which is why a birth plan can be really helpful. Now, that isn't to say that your doctor might find something that shows you need an induction, and even though you didn't want one, you need to have one, or, the hospital's too full and you can't get an induction. Things like that can happen, but this gives you kind of like a little bit of control over those last few weeks if you want it. But if you're going to be induced, I think it's really important to go over what an induction is going to look like. And I got to say, providers maybe are not the best at it. I actually have a whole video on if you're going to be induced, the questions that you need to ask. I'm going to link it down below. And I also have a whole induction checklist that I'll link down there as well. And the final one is to keep moving. It is really tempting to just curl up on the couch and not move. But the more you can move during your day, I've said it before, but when you're not actually in labor, you're really looking to get this baby just in the right position in the womb. And I saw a midwife, and I loved the analogy, who said you just kind of have to wiggle the cork, to get it in the right spot. If you're thinking about putting a cork back in a bottle, you have to wiggle it to get it in the right spot. And that's really what you're trying to do before you're actually into active labor. So doing things like the mile circuit or curb walking or just walking in general or changing positions, or my favorite, the sexy hip circles on that yoga ball, because that is also going to stretch out your very angry ligaments. Those things can be really helpful. So don't just curl up on the couch and watch TV. If you can rest, sleep is queen in this situation. But when you're not asleep, movement can be a really big win to get that baby just in the right position into your pelvis. But also don't overdo it. You don't need to be out here super sore because you did the mile circuit for 2 hours. Nobody needs that. Just do it, in the limitations that your body has. Now let's talk about what not to do. And the first one, which I totally did, is don't blame yourself. I think there's far too many people on social media who act like they have the keys to putting you into labor, when in reality, they just went into labor and the other thing happened to coincide with that. It is not your fault that you haven't gone into labor. There really are not things that you can do to put yourself into labor. I actually have a whole video on the 3 agreements that your body needs to make to go into labor. I'm going to link it down below because I think it's going to help you realize that you really just don't have control over this, and it's just going to happen when it needs to happen unless you get induced. I also want to say, don't keep searching for magical ways that will put you into labor, because there isn't one. There are things you can do to help your cervix soften. I have a whole video on cervical ripening, but there really isn't anything that you can do to put yourself into labor beyond what we do in the hospital. So if you really want to go into labor, talk with your provider about a possible induction. That's your best bet there. And this is actually all a post on my website. And I talk about things like stripping membranes, eating dates, nipple stimulation. All of those things are in that post. So if you're like, no, Hillary, there are things that we can do, I review the studies and show how it can help, but also how it might not work. I'll link that post down below. And my final tip is to hang in there. This is a miserable time. Your body is producing a full other human that could live outside with you. Your pelvis absolutely hates it life right now. And I totally get that. Please hang in there. You're doing a great job. Give yourself the kudos that you need. Nap when you need to. Kick your feet up. And if you have other kids, turn on the TV, because everything's going to be fine if you do that. I just want to say, I think you're doing a great job at something that is really difficult. So strong work. I just want to do a note for people who already have another kid at home. My kids got super anxious with the fact that I could go into labor at any time. And because I was 12 days overdue, I felt guilty that I was putting so much anxiety onto them. And I'm going to remind you, you don't have control in this situation. It's a great time to remind your kids that no one has control in this situation, but that you have a plan for them to be safe in a loving environment when you go to the hospital, and you can't wait to see them after you have the baby. So if that's you, that was compounding my anxiety, because I had 2 other kids who were like, when is this going to happen? Every day I'm so nervous when I wake up to know if you're here. I get it. You're doing a great job. And I'm going to give you those 3 agreements that your body needs to make in order to be able to go into labor. I'm going to link it up above and down below. And just a quick reminder that the birth class that's best for you is the one that you take and actually remember. So the birth class that I recommend, I'm going to link down below, because it's going to be really helpful and you still have time for it. But thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.